Good evening, Representative Gilchrist and members of the committee. My name is Paul Kidwell. I'm the Senior Vice President for Policy at the Connecticut Hospital Association, here to support HB 5459, an act increasing rates of Medicaid reimbursement for certain providers. Can I just, before I start my more formal remarks, it occurs to me over this long day that one of the takeaways is if the continuum of care doesn't work, so if community providers don't have what they need, if hospitals aren't able to provide what they need, if behavioral health providers aren't able to provide what they need, patients get lost in the system and bad outcomes occur. So the continuum has to work together in order for this all work for patients. And for me, that was sort of the takeaway of today. Let me spend my time just talking a little bit about what are the consequences to Medicaid underinvestment over these years? What actually is happening because of it? So first, for Medicaid beneficiaries, they have poor access to relative to their commercially insured counterparts. They have poor health and healthcare outcomes, and they experience preventable health disparities related to income, race and ethnicity, disability, sexual orientation, and gender identity. For employers and employees, commercial health insurers pay higher rates to make up for Medicaid underpayment, and this cost shift amounts to a hidden tax on employers and their employees who ultimately bear the cost of these higher rates. There's a fiscal consequence for the state. By consistently underspending on Medicaid relative to our Northeast peer states from 2017 to 2022, Connecticut left more than $7.5 billion in federal revenue on the table. That's revenue that could have strengthened the care delivery system, driven better health outcomes for Medicaid beneficiaries, reduced pressure on commercial prices, and contributed to the broader economy. Connecticut Medicaid's annual rate of growth on a per member per month basis has been among the lowest in the nation. For too long, DSS has touted as an accomplishment the annual rate of growth of 0.4%. That is not an accomplishment. That means people are not getting services. Certainly, we would like to see the under-reimbursement for hospital services, which is among the lowest in the state, addressed. According to the most recent OHS report, the state reimburses hospitals just 62 cents on the dollar for care provided to a Medicaid beneficiary. Again, the remaining 38 cents in unreimbursed cost is shifted to commercial payers, employers, and employees. Hospitals have to make up the difference. Connecticut hospitals also pay significant provider tax, which generates funds to help support the state share of the Medicaid program. In 2022, Connecticut hospitals paid $850 million in taxes, which, when combined with the federal matching dollars, was nearly sufficient to fund Medicaid hospital coverage in its entirety. I'll just close by saying Connecticut's chronic underfunding of its Medicaid program in general, and for hospitals, services in particular, drives higher commercial prices. It creates access issue for patients, and it should be addressed. Thank you.
Thank you, Paul. And we're all kind of taking notes. That's very helpful data that you had in your testimony.
And all of it's in our written testimony, and we're certainly happy to provide additional information. OHS has a wealth of information that they release every year, so these are state-driven numbers.
Great. Thank you so much.
Thank you.
Thanks for being here all day.